Have you ever wondered if your child has ADHD? Well, that's what we are going to talk about on today's video. Hi, this is Dr. Obidi, pediatrician at Partners in Pediatrics and Adult Care. And on today's video, we're going to tackle this subject of ADHD because a lot of parents have concerns, and rightly so, if their kids have this condition. This is hopefully going to be one of a two-part series. And in this part, we are going to cover what ADHD is, how we evaluate kids for it and diagnose it. And in the second part, we're going to talk about how to treat it and manage it. So what's ADHD? ADHD is short for attention deficit and hyperactivity disorder. Now, the symptoms for these can show up in a number of different ways, such as a child who's always on the go. They're always hyperactive. They're always moving, can't stay still, can't wait to take their turn. So they're always interrupting or jumping in, talking a lot, difficult to pay attention to details, and when you give them tasks to do, that will have multiple directions, quickly forgetting what the next thing is to do. And so they start to do one thing, then they're off doing something else. It also includes a child who's fidgety, losing things that are necessary for work. It's also a child who is avoiding any work that's going to require a lot of sustained attention. These are some of the ways that ADHD can show up in your child. Now, as you can see, kids kind of do some of these things all of the time, right? And so it's not so much these particular symptoms, but how often they are happening or how severe they are. And especially if they're beginning to interrupt the normal functioning of the child, their quality of life and the quality of life of the family, the quality of work they're doing at school. And so if your child has any of these symptoms and you're wondering if this might be ADHD, it is worth taking a look at it. And the reason is that when you have a child who has ADHD and it's not managed, this can lead to problems down the road. So you have a child who becomes more and more demotivated or discouraged when it comes to schoolwork because it's becoming more and more difficult. They start to have a dislike for schoolwork. You can also have a child as they get older and into the teen years that are beginning to get into more trouble, sometimes beginning to experiment with drugs because they're trying to get their minds to quieten down. You may have a child who gets into trouble with the law as they progress into adulthood. If it still remains a problem, can get into more problems with the law, have more difficulty holding down a job or a relationship. And so it's really important, if you feel your child might have ADHD, that you bring this up with your pediatrician. So if you're a member of the practice, for instance, that you're making an appointment and coming into the office so we can talk about what's going on with your child and start to go through the process of doing an evaluation to see if there really is a condition that we need to diagnose and address. So if you are worried about ADHD and you've made an appointment and you bring the child into the office, what can you expect? This is what this will look like. We will take our time to have a conversation about what is going on. So getting an idea of the symptoms or the signs that you are seeing that are worrisome for ADHD. We're going to ask a bunch of questions to make sure there's nothing else going on that could be showing up as an attention problem, such as issues at school, the quality of their sleep, because sometimes conditions like obstructive sleep apnea can cause attention issues, and make sure there isn't like a thyroid condition, for instance, which can also sometimes mimic as an attention problem. In some situations, we will order some blood work to rule out some of these conditions. Now, the main thing though with diagnosing ADHD is using a standardized form to collect some information in more than one setting. So at home from the parents and also at school from a teacher, because ADHD typically will show up in multiple settings. And if you're having a problem only in one setting, it is a red flag to look for other things. So you have these standardized tools, which basically are form of questionnaires. And one of the common ones we will use here at the office is called the Vanderbilt assessment form. There's a teacher version and a parent version. And these ask a bunch of questions that try and find out how much hyperactivity is going on, how much inattention is going on, how much impulsivity is going on. It also screens for depression and anxiety, a conduct disorder, oppositional defiant disorder. And when these forms are returned, we can score them and see if they hit the threshold for diagnosing these conditions. Unfortunately, right now, there isn't a blood test or some other sort of definitive test that you can use to diagnose ADHD. It really is getting information, getting a very good history to make sure there's nothing else going on. As part of the information gathering portion of evaluating for ADHD, we will also get some family history as well. Do we have parents who have been diagnosed with ADHD? Do we have other siblings that have been diagnosed with ADHD? Because it can also provide more information as to whether this child we're evaluating will have ADHD as well, because it does run in families and there is a genetic component to this condition. Now, ADHD can be classified as 3 different kinds. There's ADHD predominantly inattentive, which used to be called ADD, just attention deficit disorder, but now it's all called ADHD, attention deficit and hyperactivity disorder, predominantly inattentive. Or number 2, ADHD hyperactivity predominant, if there's just mostly a lot of hyperactivity, or ADHD combined, where you have both a lot of inattention and a lot of hyperactivity. So if you're listening to this video and you're thinking, I think there may be something here worth looking into with my child because I see some of these symptoms that Dr. Obidi is talking about, call the office at 301-791-7060 so we can sit down with you and your child, get some of this information so we can get an evaluation going. If you do have a child who is displaying a lot of these symptoms, that can be quite frustrating because you can see that there's more they can do, or it's just making parenting more difficult. There is hope at the end of the tunnel because there's definitely help for you and your child, and we can talk through some of those here at the practice. And I will definitely be going through these in our next video, where we are going to talk about how to treat ADHD, how to manage it, some tips for parents when it comes to helping with homework and home life, help you take care of your child with ADHD, provide you some resources and some tools to help you parent more efficiently. All right, till next time, it's Dr. Obidi here. Bye.